Hey, wow, VIPers, welcome to another edition of Thirsty Thursday Facebook Live on the Women's Online Wellness community. I'm back into my makeshift man cave pseudo studio because even though it's a beautiful day outside on my porch where I like to be on these pretty days, and I think you like to see my dog out there, well, two things. One is it's a little breezy, so I'm afraid that my notes, and there are notes, would be blown to smithereens. But more importantly, my wife is currently out there with a bunch of her girlfriends having a Zoom happy hour. So I've been kicked off of my regular broadcasting station and relegated to the confines of my backyard man cave. So that's where we're at tonight. And tonight we're going to talk about some stuff that is quite understandably controversial. It's actually created a lot more controversy than I realized when I first got into this. When I first started researching this, I was quite taken aback at the veracity of opinions and the almost just anger that came out as I was researching. So I've spent the last 3 or 4 hours just really digging in to this question about hydroxychloroquine and chloroquine and whether or not it should be used or how it should be used. And I can promise you there's 1,000 different opinions for every question that comes up as it relates to this. So I just wanted to tell you right off the bat that I know I'm going to ruffle some feathers with some of the things I'm going to say, but everything that this community is about and everything that I'm about in trying to bring this information out is accuracy, is scientific vigor, and making sure it stands up to truth. So even though I might ruffle some feathers, I might make some folks mad, I've got to make sure that you understand where my biases are. My biases are I'm not listening to politicians when it comes to science-based questions. In fact, I wish we could just get all those folks off the podium up there. This is no disrespect and no political statement about the president in any stretch. He's doing a great job getting information out. But I think it needs to be limited, and then let the doctors and the epidemiologists and let the folks who really understand the science get up and talk about scientific questions. And there's economic questions and there's other stuff going on. I get it. I understand that. But all this information I'm telling you tonight is not political. It's not biased for, how did this ever get to a place where I even have to say that? It's just nuts, the fact that this has become so polarized that people are looking at this information, should I take this drug or not? And they're dividing up based on their political beliefs. It's nuts. It makes no sense. I don't get it. I don't understand it. I don't like it. And it's a waste of time. So everything I'm giving you tonight is based on hard science. It's based on recommendations that have as little bias that I could identify, because like I said, I spent the last 4 or 5 hours digging into these, reading these papers, looking at this research, trying to view it from the eyes of both a physician and someone just trying to learn, because granted, this is out of my wheelhouse. I've never prescribed Plaquenil, which is the brand name for hydroxychloroquine, because let's look at what it does. What does it do? It treats malaria, it treats lupus, and it treats rheumatoid arthritis and certain autoimmune disorders. That's not what I do. So I had to spend a lot of time culling through a lot of garbage. For example, there was all this stuff circulating on the internet about, we should drink tonic water because it has quinine in it. And there was some idiot chiropractor who got on video and talked about the benefits of taking quinine water and calcium or zinc. And of course, he was selling it. Is that a real surprise? But that's the kind of garbage that we're having to sift through to try to get away from this misinformation and these myths. And I can promise you, when you're searching for information on the internet, you probably are just as good as the recommendation I made earlier about looking at news. Look at it maybe twice a day to get your news. Don't spend all day with CNN on in the background. You'll go nuts. And the same thing applies to going on the internet and trying to get information on a different topic as it relates to this, because chances are you're going to get led down a rabbit hole into a path that you are going to get just more confused on. So that's what I've done for the last several hours, is try to sift through this, actually read the papers that are talking about this, and give you this information in as understandable a form and as a discrete, succinct form as I can. The biggest problem I had was trying to get this information together so that I could get it out and it wouldn't take 2 or 3 hours, because there's a lot of stuff out there. So I'm trying to get it into a place. I know this is going to generate a lot of questions, and just the way my setup is here, I can't see a lot of the questions as they come up. They kind of go up and then go away. So I promise you, and those who comment on these know that I follow through with this. I read every comment and I answer every question. So I promise, if you have a question or a concern or a comment, I'm going to see it and I'm going to respond to that. So please put those in, and I might not get to them during this time frame, but please put those in there, and I promise that I really, my commitment is, if you take the time to watch this and you take the time to make a comment, I'm going to give you some kind of answer, at least acknowledge that I'm reading those. So that's my promise to you. So given that, and given that this can't be construed as medical advice, I have to say that my attorneys, the really respected law firm of Dewey, Cheatham, and Howe, you all probably have dealt with them in the past. I have to give that disclaimer. This is not medical advice. In fact, this really goes to the core of what my response is going to be, is you really got to talk to your individual doctor when it comes to what you want to do about this. So just know that this is opinion, this is information, this does not construe medical advice, and I just want you to stimulate you to think about what's real and what's not, and hopefully not waste a lot of your time going through a lot of garbage. Worst, don't fall for any of the scams that are floating out there right now. So again, my bias is I don't listen to politicians, to journalists, to Dr. Oz. I'm sorry, I know there's probably a lot of Dr. Oz fans out there. I mean, this guy he started out great, but he's really gone a little bit off the deep end, and a lot of in search of ratings. We'll just leave it at that. Read between the lines. So I don't use that as my primary source of information. I listen to the scientists. I listen to the medical experts. And I do that in 2 ways. That's 4. I do that in 2 ways. Number 1 is I look to the people who are doing the research, the people who are doing the bench science, who are doing the hardcore work on discovering truth. And then I also look at clinicians, people who are on the front lines, people who are dealing with this COVID-19 disease on a daily basis, and what they're having to say about what they're doing and what they're using. Those are my sources. That's where this information is coming from. So hopefully that will give you at least some understanding of my biases, and everybody has biases, so I hope you understand that's where I'm coming from. And you're going to see me referring to the notes here because, gosh, I mean, like I said, I've probably got 8 pages of notes here, but I promise not to keep you for 8 pages worth of notes. But it just took that much to try to make some sense out of the information out there. So hopefully it'll provide some coherence to your understanding of this particular question. Should I be taking hydroxychloroquine? And that's really the basis for all this. I do want to do a really quick overview because you guys are smarter than the average bear. You guys understand things a lot better off than a lot of folks out there because you take the time and you care about knowledge. You understand that knowledge is power. You've gone beyond that and know that the application of knowledge is wisdom. So we've got to start with the knowledge. So bear with me. I think you'll find this somewhat interesting. The original thought of using hydroxychloroquine, and where did that come from? Would that just pop into somebody's head one day? Well, actually, this is a drug that's been around since the 1950s. The chloroquine, the base of that, has been around since the 1930s. So as people say, and say correctly, there have been millions, if not billions, of people using this drug. And again, what is it used for? It's used for malaria. It's used for lupus treatment as an anti-inflammatory, for rheumatoid arthritis, and for some other autoimmune problems. So it's been around. People are used to using it for those indications. Why it's being looked at for COVID-19 is that there were a couple of papers done back during the MERS and SARS and Ebola problems that showed that there was some antiviral activity. Just think about this. Plaquenil or hydroxychloroquine is an anti-malarial drug. Well, where did Ebola really create problems? Well, it was in Africa. Where is malaria endemic? It's in Africa. So it's natural that those medications were looked at in a setting where they were used a whole lot. And it did determine that there was some antiviral activity. So back in February, when all the poo-poo hit the fan, even earlier now, but somewhere in that range, a physician who worked in some of those epidemics wrote a letter to a journal saying, gee, maybe we ought to look at something like hydroxychloroquine, along with about 4 others he mentioned, to see if it might help with this COVID-19. That kind of triggered the interest. That's where it all started. That's where it all came from. And just again, as a way of review, why does it work? Well, the hydroxychloroquine seems to help, and I'm not going to go deep into it because that's just getting in the weeds. I don't want to confuse things. But it does seem to help prevent the virus from actually getting into the cell, the lung cell in particular, the pneumocyte. It prohibits it from getting into the cell by interfering with the little receptor that attaches to the corona spike, the envelope around the virus. So if it blocks the virus from getting in, then obviously that's a really good thing. Also, what it does is once the virus gets in, which it does sometimes even when you're taking hydroxychloroquine, it seems to reduce the ability of the virus to replicate. So that's the basis of why scientists even began to look at it from the start. You know, if there was just some anecdotal reports of people who took it for anti-malarial and didn't get something, that really wouldn't make much sense. But when you could actually look at the science and say, hey, there's really a mechanism, there's really something here that works, that shows why this would work. It's not just an effect, it's a cause and effect. It's not just an association, it's something that actually we can prove and show that there's a reasonable reason to look at this. There's justification for trying to investigate why this might be good. So that's what prompted all that. So let's jump forward. Everything's happening in China and Wuhan. So the doctors in China, of course, you know, when you're up to your eyeballs in an epidemic, you're going to be searching and going for anything that you can grab onto to try to help steer that clear. And quite honestly, it's coming out now that we just do not have a lot of good, accurate information coming out of China, certainly not even in the early part. I mean, I saw the other day where there were something like I don't know, 15 or 20 deaths out of Beijing, a place that has multi-millions. I mean, come on. I'm sorry, but that's just not correct. Anyway, going back to that, China said, all right, let's look at this. Let's run a couple of quick studies to see if it might be effective. So they ran a study out of Wuhan and they ran a study out of Xijing, 2 of the places that were kind of on the cutting edge. And what was fascinating, both were tiny, tiny studies. One had 30 people in it and the other had 62 people in it. Now, if you knew anything about drug studies, though, that's minuscule. I mean, that's shorter than me. That's tiny. That's teeny-tiny. Most drug studies have several thousand, if not tens of thousands people. So I just want you to keep that perspective. So what was fascinating is out of these 2 different studies, they came to almost polar opposite conclusions. You have this perception out there that these studies are all saying, oh, this is the greatest thing that ever happened, you know, since sugar-laden maple syrup on your cereal. No. This first study, the Xijing study, actually showed that there was virtually no benefit compared to controls. The Wuhan study showed that people were clearing the virus from their upper respiratory about a day and a half quicker than the controls. So we were basing all this initial work and excitement on about 46 patients. The good news is neither trial really said much about adverse effects. And, again, we have a history with these meds, so we know that there's not terrible effects. But, and this makes me nuts when politicians get up and say there's no side effects. You could drink water and have a side effect. People die from drinking too much water. Everything has a side effect. And to make a blanket statement like that is nuts. Now, I'm not saying it's a dangerous drug. No, we have a lot of experience. We've got billions of people, Carl Sagan, billions and billions, have used this, but there are potential side effects. For example, we know in people who have a certain type of heart tracing or an EKG, it's called a QT interval, that we know hydroxychloroquine can change that and can make you more likely to have an arrhythmia. Not a good thing when you're already sick. Not a good thing when you have diabetes. Not a good thing when you've got cancer. Not a good thing when you can't breathe. The arrhythmias can do you in. So this is not a completely benign drug. It does have the potential for side effects. People who are on it chronically can have eye issues. Doesn't apply to acute use, so I just kind of threw that out. But the heart thing it's real. So let's just get this out of our head that this is a 100% safe drug. There is no safe. If you looked in the PDR, and a lot of you probably remember the old PDR, physician desk reference, that listed all potential drug effects. I mean, it's crazy that they called it a desk reference, because if it sat on your desk would tip over. I mean, these things were huge volumes, and now it's all online. But if you looked at the PDR and looked up Tylenol, you'd never take another Tylenol. You'd look at that and say, my gosh, look at these, this is terrible. Liver failure, hepatomas. I mean, you can have all kind of Rye syndrome, all kind of horrible stuff. So get it out of your head that any drug is completely safe. Here's the one thing I want you to consider, and this kind of cuts to the bottom line. Yes, there may be some benefit, and I'll cover this a little more effectively, but I want to throw this in right now. We in America are just simply going to have to be satisfied at some point with the trade-off of weighing it in the scales. Are the benefits going to outweigh the risks? It's going to come down to that. It's going to come down to realizing and accepting the fact that there's going to be a certain number of people who are probably going to benefit from this, but there's going to be a certain number of people who are going to get arrhythmia and are going to die. It's just going to happen. Now, granted, my research tells me that's going to be a very, very, very small number. But the fact remains, to just make some blanket statement that the side effects are, it's safer than doing virtually anything else, I think is bad science, and I think it's bad policy. That's for my little rant there. Well, one of many rants, I'm afraid, that we're going to go on with this. So you've got these studies coming out. It's starting to show that, there may be some benefits. There's a few little risks here. So as long as you kind of exclude the people who are, have an abnormal EKG or have these other risk factors, then it's starting to fall into this, it might not do anything, but it might do some good, and it's probably not that harmful. So that's kind of the attitude that people were starting to get. If it could get people out of the hospital quicker, if it could keep them off the ICU or ventilators. Notice I'm saying if it could. So far, remember in our story, so far we got information on about 50 people. Those would be good goals. But we just don't have data on things like that yet. Now, currently, there are probably about 15 clinical trials actually ongoing in China. evaluating the safety, evaluating the treatment. We've got trials going on here in the U.S. I'm going to talk about a couple of those studies. So the initial information was stuff out of China, and then came the French. There was this little old French man, this silly little French man named Dieter Rout. Now, Dr. Rout is a very, very accomplished virologist, and he's based in the Marseille region of France, where they experienced a lot of issues with the virus. And he's gained a tremendous amount of notoriety in the last few weeks because of his histrionic statements about hydroxychloroquine and Z-Pak. That's where the first stuff about the Z-Pak comes in, is a cure, his words, not mine, a cure for COVID-19. And he made all the media rounds. He was, of course, on Dr. Oz several times. And his initial experiment was the first to really do a controlled trial. And when I say controlled trial, I mean that they had some people that they treated and some people that they didn't, sometimes. To look at the COVID-19 treatment with hydroxychloroquine and Z-Pak. And the first preliminary results that he pushed out to the media, even before he wrote a paper, even before he put it in a journal, he just called up, his the Marseille journal, whatever, and said, "Look, we're curing everyone." That's my attempt at a French accent. I know it's pretty poor, but he was talking about 100% recovery rates. Well, that got everybody interested. In fact, it got President Trump interested, because back in March 21st is when he first made that, what I kind of figured was an infamous tweet, where he said that the academic journal, the International Journal of Antimicrobial Agents, had published a study that showed that hydroxychloroquine cured 100% of people. I think the term he used was a game changer. Well, this was the initial study by our Frenchman, Dieter Rout. And maybe I'm being snarky, but the editor of the journal, first of all, the paper was not reviewed by anybody. It was submitted and published within 24 hours, which is unheard of in journals. Usually it's peer reviewed, it's gone through and you point out things, you rewrite it, you make sure it's really 24 hours. And the editor of the journal, well, Dr. Rout was this guy's boss. I don't know, it just smells a little bit. Anyway, let's go to the study. The study had 42 patients. Again, study, 42 patients. 20 got hydroxychloroquine, and only 6, get this, only 6 got hydroxychloroquine and Z-Pak. And they used 16 as control. So his statement that hydroxychloroquine and Z-Pak was a cure for COVID-19 was based on 6 patients. 6 patients who were not that sick, if you go back and actually read the paper. In fact, the national organization that oversees that journal went back about 3 days later and said, quote, "The article does not meet the society's expected standard." But as we all know, in this 24-hour news cycle, in this media crazy, internet crazy world, the cat was already out of the bag. All he had to do was make a statement like that, and the media beat a hasty retreat to Marseille, and he became a viral rock star overnight, and is still out there touting it. Now, here's my caveat. He may be right, but he's not right now. But he may turn out to be correct at some point. But for God's sake, make it real. Get the science. Don't become some media superstar touting something that could be incredibly dangerous for you're talking about a worldwide usage? Well, what if this was just a side effect of that arrhythmia was 0.01%? Well, if you've got millions and hundreds of millions of people taking it, well, okay, let's weigh that against what the potential benefit is. If there's a benefit, and we can't even say that 100% right now, that's my point. I hope this is making sense to you. All right, then there was another study out of France that was in a different region of France, and they only had 11 people, and they did the same hydroxychloroquine and Z-Pak, and they actually didn't show any benefits. So then the U.S. kind of got on board. By this point, by the time all these studies were going on, it was finally hitting our shores. So we're beginning to see some more studies coming out of the U.S. looking at this, looking at whether or not this is safe. And the first study came out of NYU, and it looked at about 84 patients. So at least we're looking at more people. And they found that there was potentially, and they underlined potentially, a reduction of symptoms. They didn't say whether it was protective. They didn't say it was keeping people out of the ICU. They didn't say it was preventing disease. They said there was a potential reduction in the intensity of symptoms. But what they did notice is that get this number here, 30% of the people that they used this in did show a prolongation of that QT interval. So that was kind of scary when we saw that. So there are large, very good quality studies coming on. They're underway in this country where we can really hopefully count on the data. This is not just looking at using it in hospitalized patients, but it's in using it in prevention. All these things are under study right now. So where are we with all this? A lot of people are saying, well, heck, if it's helping, what's the problem? Why don't we just use it? I mean, you talk, all these people talking about controlled study. Well, you don't need a controlled study to say that a parachute works. You're not going to take 10 people up in a plane and drop 5 out with a parachute and drop 5 out without. And yep, okay, we can say that a parachute works, so you ought to use a parachute. Well, that's kind of a fallacious argument, because there's a thing called effect size, meaning that everybody who jumps out of an airplane is going to be affected by whether or not they have a parachute or not. That's a big effect size. So the larger the effect size, the smaller your study can be. But the smaller the effect size, the larger your study has to be to really prove what you're doing. So with that being said, we know at this point that 98% of people do not die, probably greater than 98%. In fact, the vast majority, we're talking about 75 to 80% of people who get this virus have mild to moderate symptoms and do fine. So that that's a very, very small effect size. You literally have, if you're interested in trying to minimize the severity of disease, you want to make sure what you're doing is going to have that impact. So you've got to have a large number of people to test. We don't have that. I know, and I've heard this before, and I get it, and I understand it, and that's why when I give you my opinion, it's going to play into this. It's all about weighing it in the scales, and if you have something that might work, are you willing, as a patient or a physician, to take that risk? And in many cases, the question is yes, and we'll get to that in just a minute. But I just want you to begin to get a little bit of understanding of how you think through these things and why you can't pay attention to all the garbage that's out there, just spouting what's unfortunately become a very polarized argument that's based on anything but science. We have a lot of history in this country of medications that we thought were really good that turned out down the road to be not really that great. a number of years ago, there was a wonderful medication that really was effective at preventing miscarriage. I mean, it was great. It really helped prevent, I mean, what's more devastating than an early miscarriage in somebody, especially repeated miscarriages? And it was so effective at helping that. It really brought such joy to these people who had not been able to have pregnancies because they would have repeated miscarriages. But on this medication, it was really wonderful. It brought them past that so they didn't have to go through the devastation of another miscarriage. Many of you know the name of that medication, thalidomide. It was only after these babies were born that we began to realize that, well, maybe we didn't test it as thoroughly, and we got a little aggressive about utilizing something simply because it was there and simply because it was available. So, several considerations. The FDA has just come out and approved an abbreviated drug application for hydroxychloroquine because it was not indicated at this point for the treatment of COVID-19. Now, us doctors use a lot of drugs, what we call off-label. I do it all the time in our practice. Every doctor does. For example, I'll use there's some medicines that are very effective for weight loss that we'll use in our program that are not FDA approved for weight loss, but we use them for other things so we know the safety profile, et cetera, et cetera. So the FDA has now formally said doctors can use hydroxychloroquine in specific situations in hospitalized patients who are ill. Now, they've not defined that, but obviously if you're hospitalized, then you've got obviously certain issues going on. But they have approved that either to be used in that setting or to be used in a clinical trial. All right, so here's a very serious point that I want to bring out because it is that law of unintended consequences. People say, well, what's the harm? If this seems to work a little bit, well, maybe it doesn't work that great, but it works a little bit, why don't we all just take it? Well, here's one of the big issues. There's not enough of it out there, and you're starting to see a large number of people who depend on this medicine already not being able to get it. As I mentioned before, lupus, one of the most common autoimmune diseases. Rheumatoid arthritis, incredibly, millions and millions of people in this country suffer from those two alone. They are struggling now to find their medication because of this panic and people getting it inappropriately prescribed, people hoarding it, doctors prescribing it for their family and friends, hoarding it. I'm ashamed to say that there's evidence of that. But the result is people who really need it to live are not getting access to it. Yesterday, I called around to 8 pharmacies here in town. 4 of them couldn't get it or didn't have it. 3 of them said that it was they would only accept scripts for people with a diagnosis of rheumatoid arthritis or systemic lupus erythematosus. And one of them was so confused by my question, they just hung up on me. So I don't know, whatever. But my point is, this shortage right now is very real for these people. And I think to ignore that is as a society and as people who are concerned about the health and welfare of the country, more people die of complications of lupus every year than have died from the coronavirus, and probably that will die from the coronavirus. So put that in perspective. What we're doing by hyping this unnecessarily at this point, by stripping the supply from the supply chain, we are depriving people who need this for their life to have any quality of life. That's a critical understanding that a lot of people forget about. And this is not just me doing this. This is the American Association of Rheumatologists. These are the people And as I mentioned before, I'll go to the clinicians, and these are people who do this on a daily basis. They treat these patients, and they know how dependent they are. And they've been very vocal about this, saying, look, we've got folks that we've been treating for years with this medication, and we can't get it for them now. They can't get it. So just keep that in mind as part of this debate. And it's straight from the mouth of both the patients. In fact, I've been contacted by a couple of folks today that said, that have these problems. I mean, this is in our community, that have these problems and have had issues trying to get their medications in Augusta. So it's real, and it's going on. So we've got to be cognizant of that, and we've got to be understanding of that. And for God's sake, just at least wait till we have better science. So both hydroxychloroquine sulfate and chloroquine are now listed on the FDA shortage list as of March 31st. Obviously, we're trying to get much more of it, and that's being hopefully accomplished. Just looking at my notes here and making sure that I cover everything I want to. So, all right, well, I've been ranting now for 36 minutes, so let me get down to brass tacks. Let me get down to what is my opinion. I underline my opinion, and this is based on 30 years of doctrine, but more importantly, spending some time these last weeks, and in particular this last day, really delving into the information. So take it for what it's worth. Again, I encourage debate. I encourage opinions. If there are things that I haven't covered or that I've said incorrectly, point them out, and I'd love to go look at them. And believe me, I do not know it all when it comes to this. My knowledge level is changing every day, but it is far below those who are dealing with this medication for 50 years. But anyway, my thoughts is you are sick enough to be admitted to the hospital and you don't have a contraindication, I think it makes sense. I think it makes good sense to use it. I think there's enough evidence that we've seen both in what physicians on the front line are telling me and what we're seeing in some of the studies, that for people who are ill, that it can reduce the duration and the intensity of that in combination with all the other supportive therapy. So if you're in the hospital and you're sick enough to get in the hospital, yeah, I think it makes sense as a part of your treatment plan. And again, that's a blanket statement, and you got to understand that that's very individualized, and it has to be between you and your doctor. Should people take this as a preventative tool? No, absolutely not. There is zero clinical evidence that it is preventable or used as prevention. What is? Physical distancing, face masks, hand washings. There's no question that those things have been effective. But going out and getting a script from an unscrupulous doctor, because that's, in my opinion, what it would be, just as a tool for prevention, is not backed up by science. It's just not there. Will that be different 3 weeks from now when different data and studies are out there? It might be. And I'll be the first to come on here and tell you that, because nothing would make me happier than to see a good study, excellent evidence that said taking this drug can prevent people from contracting the disease. That would make me ecstatic. That would be fabulous. My 401k would skyrocket. I'd be happy. But until we see that, taking it as a preventive tool is a no-no, in my opinion. Should you take it with, if you do take it with the Z-Pack, should you take it with zinc? There's a lot of studies and a lot of stuff buzzing around out there now about combining zinc. And the reason is, and just a quick little lesson about zinc, Zinc is known for a long time to be virucidal in certain instances. That's why people take zinc for colds, because most colds are caused by viruses. Well, for zinc to be effective, zinc's critical for the immune system. I saw a study that almost 40% of people over 65 are deficient in zinc. So taking zinc with this stuff obviously is a good thing, because it's going to build you back up, help your immune system function, help you fight off these things. We also know that chloroquine is an ionophore for zinc, meaning that it helps transport the zinc ion across the membrane to get into the cell to do its thing. So the combination makes sense. So yeah, if I'm somebody and I'm on hydroxychloroquine, yeah, I'm probably going to be taking zinc also. Taking zinc by yourself, or taking zinc with tonic water or quinine water, is that going to do anything? If you're deficient in zinc, it probably will help, but other than that, no. Should people take it if they're sick but have tested negative for coronavirus, or have not been tested at all? No, because you may have the flu. Statistically, it's much more likely. I mean, just look at the data showing the number of tests done and the number of positives and the number of negatives. The vast majority of people getting tested are testing negative. So if you've got a sore throat, or if you've got sinus problems, if you've got a cough, first get tested, and the testing is coming online and a lot more effective now. But if you're not tested, or you're tested negative, no, don't take it. If you just got a sore throat and a cough, and you call up your doctor and say, I want hydroxychloroquine, I hope they've got enough good sense to not give it to you unless you've been tested. I'm getting worked up here, sorry. And finally, will this information change in the next few weeks? Count on it. It's going to. I did a mention of hydroxychloroquine about 2 weeks ago. And I went back and looked at some of that information, and it's different now. So 2 weeks from now, it's going to be different again. I'm going to do my best to keep you updated. If I discover that something I said today is out of date or wrong, I'm going to get back with you as soon as I can. I think that's the charge of what this is to try to provide as accurate of information as we can in a timely fashion. For those of you who've been a member of this community for a number of months or a number of years, you used to know this was all we used to do. It was one Thursday talk on a variety of different things. And it's only with the onset of this COVID-19 that we began doing these things more frequently, because the stuff just changes that quickly. So I want you to understand that we're going to get back if something changes. I mean, heck, if somebody comes up in the comments with a paper that they saw that contradicts what I said, I'll be on this thing again tomorrow touting that paper. So just know that that's what we're doing here, at least for this time, this duration. I promise you, one day, we're going to get back to other stuff. One day I might talk about something besides the frickin' virus, but not now. Not now. We're going to keep you informed. Sorry, I just got worked up there. I can't really see a lot of the questions right now. I'm going to kind of scroll through some of these. I promise I'm going to read every comment, and I'm going to respond to every comment. I greatly appreciate this. There's a question, Debbie asked, what does this drug do for people that have lupus and rheumatoid? It has an anti-inflammatory effect. As you know, the autoimmune diseases are basically everything that happens to a person is a result of inflammation from these diseases. Well, the Plaquenil or the hydroxychloroquine has a bit of an anti-inflammatory effect, well, in fact, quite a good anti-inflammatory effect. Most drugs, you'll find, and the reason we have drug side effects is most drugs don't just do one thing. Like this one just does not block that virus from getting into the thing. This anti-inflammatory effect is where it reduces the influx of things called cytokines and white blood cells and all these chemicals that create the pain, the soreness and tenderness and the breakdown of the joints. It inhibits that also. So that's why it helps lupus and rheumatoid. Look up here, see if there's any. Tammy asked about the health of the 6 people that received the medicine. That in the one study where they all recovered, yes, most of them had very mild symptoms. These were not people in the ICU. These were not people on death's doorstep. So again, that's why this study was not one with a lot of vigor and we could put a lot of emphasis on with regards to its effect on people who were truly, really ill. Great question, Tammy. Thank you. Let me look up here. And somebody else asked about lupus. Hopefully I answered that question. You're right, Tammy. Every drug has side effects, and we're going to know more. And we've got, I promise you, from all the, I went on the National Institutes of Health website today and just looked at all the current clinical trials that are ongoing, both in the U.S. and around the world. And there is a wealth of brilliant people who are doing a lot of good work. It just, by the nature of the work, it takes time. And they are accelerating things in every possible way that they can, but they don't want to compromise what they're doing and put out bad stuff like some silly little Frenchmen have done and create a problem for a lot of other folks. And let's see, yeah, a lot of, well, I appreciate all the comments and all the people watching. I promise I'm going to go back and respond to all of them. I hope this has given you some insight and given you some direction. It comes down, if you are considering using this medication and you fall into one of those parameters that I just discussed, you really have to sit down and look at it with your own doctor and weigh the benefits versus the risks and make a decision based on that. Just like anything else, they talk about all politics is local, all healthcare is local. And I can sit up here all day and spout studies and spout statistics and epidemiology and public health. But when it really comes down to it, it's between you and me, or you and your doctor, sitting down, having a discussion, saying, tell me what you're concerned about. What are your problems? What are your questions? Let's review your history. Let's determine, would this work and what are the risks? And then making a choice. And that's what it all comes down to, just 2 people putting their heads and their hearts together and coming up with a decision. And that's the way it ought to be. And we hope that everybody else stays out of the way. So, till next time, make healthy choices.